how they adjudicate the claims.
Exactly.
Regardless of what the person individually does, if they don't elect parts A and B when they turn age 65, our plan's still going to pay as if they did. So we're going to make that assumption. Now it's up to and when we we send out packets to everybody about 3-4 months ahead of their 65th birthday, say you need to make your elections, go see Social Security, do all this stuff because our plans are going to pay as if you had part A and B, and the only way you get that a person can get out of Part B is if they are themselves actively employed, or they have a spouse that's actively employed and cover them under a health insurance plan. Then a person could waive out of Part B for a while and not have a penalty, because that actively at work rule comes into play, in which that other plan becomes primary and secondary, and Medicare would be secondary. However, you've still got to enroll in Part B when you lose your eligibility under an active coverage plan. So Blue Cross is always going to assume, though, unless that special circumstance, that the person is enrolled in A and B, and that's how they're going to adjudicate the claim.
Yeah,
So,
that's exactly right.
Yeah.
So that's why we want to make sure that that confusion is cleared up, that we were always going to adjudicate that claim that you have A and B. And so Medicare is primary, and so Medicare will pay whatever that percent is, usually 80% of that claim, and the provider will send us the claim to adjudicate the rest of it. So we will process the claim according to the city's group plan. So it's not just like we're going to cover whatever Medicare didn't. We're just going to process the claim like according to your group benefits, which would be your deductible, coinsurance, copays, anything that you have, just like you were when you were an active employee. You know, you had your deductible, copays, coinsurance. It's the same thing like even if you're a retiree. It's just that the claim goes to Medicare first, and they will process what they're going to pay, and then Blue Cross will pay the rest. Does that make sense?
I mean, because that almost sounded like a supplement, the way you described that. That because you
No,
said before,
a supplement.
A supplement would be Medicare pays and then we pay
Whatever's left over. But this plan will adjudicate the claim, but they're going to process according to the city's benefits, which means you have deductible, coinsurance, copayments.
So
You're still responsible for
Okay.
that as an employee.
Okay.
Right, so with Medicare pays their part, and then our plan, you still have to meet your deductible, co-insurance rate, office visit payments, all those come up front before the city's plan will pay.
So on the group plan then with the retiree, is their experience basically just like they filed a claim with Blue Cross and Blue Shield, just like you would otherwise with the deductibles and all?
Yes.
But then you all process
After Medicare does.
you process it through to Medicare?
Like Medicare would process it first, and then we would kick in and process it just like a group plan.
With the deductibles?
Mm-hmm. With deductibles, copayments, like say I think a good example would be, say someone did not elect Part B, right? Part B is professional, which means you go to the doctor's office. Okay, we are still going to process that claim like you had Part B coverage. So Medicare pays whatever they're going to pay. We would apply a copayment now, right, or your deductible on that claim, because there's no difference between if you've elected or not. We're going to assume you have it, and so whatever Medicare is paid, the rest of whatever's left over that we have allowables, because we'll have
So if the retiree didn't elect the Plan B, does it leave them without some coverage?
Yes.
So because you're going to process it as though
Exactly.
they have, but then if Medicare doesn't pay on that,
that's what we really want to stress, is that
Retiree responsibility.
the retiree, it's their responsibility. So that's what we're saying, that it's up to them. I mean, you're not forced to elect Part B.
but you're going to lose some coverage.
You're going to lose
in
coverage,
that.
yeah.
Where if it was a pure supplemental plan, it'd be regardless of what they had applied for, whatever Medicare didn't cover, the plan we covered.
Correct, yeah.
So, and that's where you're saying that we roll that out to retirees, send the information to them before their 65th birthday. If we identify someone who falls into that gap and doesn't have that Plan B, they turn 65, they don't have that Plan B, do we communicate with them again to help explain that?
Yes,
Okay.
that we tell them that you have to enroll in Part B.
And then like an open enrollment, we probably cover that as well if we're dealing with
Yeah, because
individuals.
what we require them to do is when they become 65, to give us a copy of their claim card, which is the Medicare, your Medicare card, because it's got nowadays it has your Social Security number typically and a letter followed by it that identifies something for Social Security Medicare world. So that we make them give that to us to set them up. So we're trying to avoid the member having problems because if they don't elect. Okay. So we try to get there, and so to help, I think I'm going to steer this back to the member experience. The provider is going to file the claim to Medicare first. The Medicare does its things. They're going to get payment. The provider then files with our plan as secondary. Blue Cross is going to process the claim as the estimated or actual Medicare up to the Medicare allowables and a certain percentage. There's a cap there based on the provider. So that way it goes through, and the takeaway is that our plan, we're not going to pay 100% of the claim. The member's still going to potentially have out-of-pocket expenses until they reach the maximum of those. So folks need to understand it is not a supplement which covers 100% of what Medicare does not pay, that remainder 20%. Our plan, there's still exposure to the member. And it's
There
always
is,
been
yeah.
that way.
And I get that question at open enrollment. I mean, I got quite a lot of questions from retirees saying, because, Blue Cross offers a lot of supplement plans, right? So I want to make sure that they understood that this is not that. And so I've gotten those questions at open enrollment. People have come over to our table and kind of wanted to know, should I go, what should I do? And we always, you have to, it's better to enroll in A and B. You're going to have the most coverage that way.
You said something a while ago about you usually pay 8% of the claim. Is that what you said?
No, Medicare majority usually pays about 80%.
They pay 80%.
Yeah.
Okay.
Now, that's not like a rule on every claim, but the majority is they pay 80%.
How do y'all come up with the sequester amount?
We coordinate with Medicare, so when you go to the provider, right, you go to the doctor's office. That doctor's office is going to file that claim first with Medicare. Medicare is going to process the claim according to Medicare's benefits, right? Normally 80% they'll pay of coverage services. Then that claim, the EOB, the explanation of benefits at what Medicare paid, goes back to the provider. The provider then now files a claim with Blue Cross Blue Shield with us. And so then we go through our claim system and we look and see if the member deductible is applied first, co-payments and things. So that is all adjudicated in the claim, and then we'll find out what your member actually owes after that.
So, but to answer your question about the sequester, that was Congress, the feds decided there was going to be a sequester amount, and they directed Centers for Medicare and Medicaid Services to withhold payments to providers, and that was their doing, and we'd have nothing to do with that. So the sequester amount is a federal.
I mean, it's a Medicare
payments.
CMS
That's Medicare.
law. There's nothing.
Sometimes the doctors send for that to be paid, and sometimes they don't. What is that?
Well, the providers, if they want to get paid, they should file the claim. I mean, that's the only way they're going to get paid is you have to file a claim.
So the sequester amount is not really to the retiree, it's to the doctor to file it with Blue Cross. Is that what you're telling me?
No, it's for the provider when they file with Medicare. If the amount has been sequestered, my understanding was that the feds withheld payments to providers due to the sequester, so that's money due the provider. It's not, the member doesn't make up that difference. It's the Medicare will eventually pay that or not, but that's up to Medicare to
Yeah,
decide.
there's no member liability.
Sequester's not
in
our
that.
responsibility.
Yeah.
Or the member's responsibility. This is a federal action.
Yeah,
So,
that federal action is really between the provider and Medicare. CMS.
if I'm starting to lie over there, y'all, but let me know. But that's not our, that's the
something
feds.
totally different. Your members should not be liable for that. That's something that, like you said, that's at a federal level that they're doing.
They just cut
and
back
so
what
what
they
will
were gonna
happen
pay.
is after that is all taken care of, then Blue Cross will get that claim and will process it accordingly.
Everybody's on Plan B. Because sometimes people are still working for the city, were working for us, and they're actively employed. That's a Medicare phrase, actively employed, that they have a spouse that turns 65 or they turn 65, and the question comes up, do I need to go enroll in Part B? And the answer is no if you're actively at work, meaning you're a full-time employee someplace, then you can waive your... But all your people, because the city's, and so the takeaway is that the city's plans always assumes you have Part A and B, and if you as a retiree don't enroll in it, there's a penalty assessed by Medicare. But our adjudication side with Blue Cross is we always assume the person has bought it regardless if they did or didn't. So.
Covered. Well, well, the city has purchased a group plan with Blue Cross and the Shield. So we have our medical policies, and we get daily claims that are experimental, that are new drugs or new treatments that have not been credentialed or gone through our criteria to be approved. There's testing, there's things that come upon that. They have to go through our criteria to be able to be approved. So that happens all the time we have to go through. Well, each carrier is going to have a different list of their medical policies. You know, everyone, us, United, everyone has their own list of eligible services. You know, we're happy to look at that claim because obviously there's something in the claims detail that they have billed that was maybe different from what you had versus them. They might have used, you know, a robotic type surgery that wasn't approved. You know, they went ahead and did it and didn't get prior authorization to be able to do that. You know, we have kind of cost containment features in place. The city is self-funded, and so we're going to be very conscious of your money. You are paying your claims. We're just an adjudicator. And so we're going to look at those type of criteria to see if it's an eligible service. Was there something, do you want to have the $20,000 surgery, or could you have had a $5,000 surgery?
Well,
That type of thing.
George, why don't you give the member to reach out to
Yeah,
myself
we'll
or
look at your
whatever.
claim.
Well, and I would say too, though, George, that from a standpoint of the providers representing us, that I appreciate the fact that they're managing it in a way that's trying to control the costs. And sometimes it can be a provider that really is doing something that maybe isn't approved, and they didn't go through the approval process first. The patient doesn't have any, I don't know if it's experimental or not, and so it leaves them in a bad spot. But I appreciate what they're doing on our behalf to try to make sure, and it's all of our behalf, to manage those costs. And so I think, again, working with Colin, that they can work through and just make sure there isn't something that was missed in the process or misinterpreted. And I think that's the best way to manage it.
Yeah, and always start with the customer service lines at United or Blue Cross, that if someone if they don't understand their explanation of benefits or what their charges are, that's what those folks there at the customer service centers are for. And they can walk someone through those charges and find out if it's just they can get the story.
Yeah.
Always start there. Yeah.
Well, one thing that I really want to make sure we all understand too is if you're going to a contracted provider, like a Blue Cross contracted provider, they are liable. It's in their contract. They have to give us a call and make sure that the procedure that they're going to do on your employee is covered. That is their responsibility. That is in their provider contract. If they do not call and get that pre-authorized or pre-certed, we're not liable to pay. The city is not liable to pay that. The patient isn't as well, exactly, because you're a contracted provider. You know what's covered and what's not. All our medical policies are on a public website. Your employee providers can go on there and check to make sure that's covered. It's just like if I was going to buy something, I would make sure what I'm buying or what I'm going to be doing. If I'm going to do a procedure that is an expensive procedure, I would make sure as a provider that that's covered because I would want to get payment. And so a lot of times, too, is they might even know that, okay, Medicare might pay for that, but they need to make sure that the secondary coverage with Blue Cross is covered as well. And they should not be making your employee responsible for that, because that's not their, as long as it's a in-network provider, yeah, they should not be able to bill that.
Paid for my insurance and I didn't get covered. That's gets to be a problem. And I apologize. I hope I'm not rude to you.
No, not at all. No, but I totally understand your frustration. I mean, I would be in that same too. If you have employees coming to you with a stack of bills, yeah, definitely call customer service. Let us know about that so we can help work. Yeah, absolutely. I don't handle claims. We don't have access to member information, but we could definitely help you get that coordinated because our policies, I'm not going to say that they're lenient. You wouldn't want us to be lenient in that, right? You wouldn't want that, but they're very fair. I mean, we have 1 in 3 Oklahomans on Blue Cross Blue Shield. So if we weren't paying for services that we should be, we would be out of business. I mean, we wouldn't be able to sustain that. And so we just have to make sure that the providers are doing what they're doing. If we have providers that are not following what they're supposed to be doing and calling in for certain pre-authorizations, we really need to know about that. We can reach out to provider relations and make sure that that provider is educated and calling on behalf of your employees. I don't know what United is. I'm not from United.
No,
Who am
no,
I talking
the United plan is a Medicare Advantage plan, and that's specifically a term in the law, and that United plan, a Medicare Advantage takes the place of Medicare.
Gotcha.
Okay, and so the person does have to sign up for Parts A and B, but it takes the place of Medicare, and it adjudicates the claims from $1, and it typically has much more like the HMO style co-payments for the event, and United's responsible for paying everything. The claims don't run through Medicare, they run through United.
So retirees who are under Blue Cross and Blue Shield, that is only a group plan?
That
It's
is-
not a Medicare supplement?
It's not a supplement, it's a
That's
coordination of
why.
benefit plan. Yeah.
Yep.
Big distinction there, because people see in the market, where I'm going to reinforce it here, they see this advertisements, oh, here's this plan by this company, and this will cover all your stuff that that are offered from other competitors out there, and then there are those standardized lettered plans, as they call them, that have standardized benefits, and people see that on television, but that's not how the city's plan is designed, okay? And so, yeah, people get tripped on that they're having to spend money. Yeah.
Yeah. And it's hard because we are such a big player in Oklahoma. We get that question even on your active plan. We get that going, oh, well, I've had Blue Cross in the past with this company. Do I have the same benefits? No, it's not. Your city's a self-funded plan with customized benefits. You've elected to cover what you want to. Any more questions? Did you have any other questions? No? We're good? Okay, you're welcome.